preconception screening and carrier testing in this genomic era has become increasingly important. These processes help individuals and couples make informed decisions about their family and reduce the risk of passing on genetic disorders to their offspring. I'm going to give you some key points to consider in relation to preconception in screening and carrier testing in the genome area. Advances in genomics. The genomic era has brought about significant advancement in our understanding of genetics and the ability to identify carrier status for a wide range of genetic conditions. Next generation sequencing technologies, the decreasing cost of genetic testing have made carrier testing more accessible. What is this carrier testing? Carrier testing is the process of identifying individuals who carry one copy of a gene mutation. One copy of a gene mutation that, when paired with another carrier, can result in genetic disorder in their child. Common conditions screened for include cystic fibrosis, sickle cell anemia, and Tay-Sachs disease, among others. Countries decide what carrier screening should be done. There's another term known as expanded carrier screening. Traditional carrier testing focused on specific, well-known genetic disorders. However, in the genomic era, expanded carrier screening panels are becoming more common. These panels can screen for a larger number of genetic conditions simultaneously, providing a more comprehensive assessment of carrier status. आजकल personalized medicine का ज़माना है. Genomic information can guide healthcare providers in offering personalized recommendations for couples considering pregnancy. Depending on the results of carrier testing, doctors can offer guidance on reproductive options such as in vitro fertilization with pre-implantation genetic diagnosis. There are some ethical considerations. With the increasing availability of carrier testing, there are ethical considerations related to privacy, informed consent, and potential psychological impacts. The couples need to understand the implications of the information provided and how it may influence their family planning decisions. Then there are insurance and cost concerns. These investigations are expensive, and a person has to think about these kind of things as well. Counseling and support is very important. Genetic counseling plays a very crucial role in the process, and it can help individuals and couples understand the result of carrier testing, make informed decisions, and cope with an emotional and psychological challenges that may arise. A word about prevention and treatment. While not all genetic conditions can be prevented, advances in genomics have led to the development of targeted therapies and the treatments for some genetic disorders. Knowledge of carrier status can be beneficial in terms of early intervention and management. Reproductive options. The couples who are identified as carriers for a specific genetic disorder may explore various reproductive options such as adoption, using a sperm or an egg donor, or prenatal testing and selective abortion. There are some global considerations as well. The availability of carrier testing and the conditions screened for can vary from one country to another. Cultural and ethical factors can influence the adoption and utilization of these tests. So in summary, preconception screening and carrier testing in the genetic era offers valuable insights into genetic risk associated with family planning. Couples can use the information to make the informed decisions about their reproductive options and take steps to reduce the risk of passing on genetic disorders to their children. Genetic counseling and ethical considerations are essential aspects of this process. Thank you very much for patiently listening to me.